straight to talk about, well, I've gone from the grooming gangs inquiry that isn't actually doing any inquiry to the COVID inquiry that's not doing a very good job either. And as many expecting will be a complete whitewash. Well, they've heard from the Education Secretary, Gavin Williamson, last week, or former Education Secretary, about what happened in terms of children, because this is what they're looking at right now, the impact on children, on education of the COVID policies. And earlier this week we heard from Sir Chris Whitty, the then and still remains Chief Medical Officer. And yesterday we heard from the Prime Minister, as was at the time Boris Johnson, justifying what actually happened under the COVID policies. And he says, well, basically children really were thrown under the bus and they basically took the biggest hit to save society. But should they have done? Let's talk to Carl Heneghan. He's Professor of Evidence-Based Medicine at the University of Oxford. Very good morning to you.
Good morning, Julia.
I've got to be honest with you, and I did let rip at one point on the show yesterday. Blood was boiling just watching Boris Johnson defending himself. The whole spiel he's got, which is the, oh, rub my hair, oh, I didn't want to do anything, but I had to. We didn't know then what we know now. None of that's true, is it?
Yeah, I just find the whole scenario quite ridiculous now. Just to say, up till March this year, estimates £130 million the inquiry cost, and my current estimate is about £1 million a week. So by April 26, that'll be 180 million. This could cost £300 million. I thought money was tight, but you're right. We've got people like Sir Chris Whitty, all these people are sirs, lords.
Oh,
Nobody
yes.
seems to get any problems here. It's all good for them. Said we could have been more liberal with children's play. Boris was saying, oh, I think possibly we probably did go too far, he said. Now, look,
I'm going to lose it again.
There's something seriously wrong here. How come these people in power could use modelers to see the future, but they can't use common sense to see the obvious? And the obvious is they went too far. If they all got up and said, look, we're really sorry, we panicked. In the midst of this, I nearly died and I feared for my life and panicked even more. All of my advisors were in one direction, and that was more harder lockdowns, and I had no way out. In doing so, however, we've learnt something. Lockdowns don't work, masks don't work, school closures don't work. Actually, we do have some useful information. And we also attack your civil liberties. We went after journalists like yourself, Julia.
And you.
MPs. And we're never going to do the same ever again. That's the end of the inquiry this week. Thank you very much. We'll close it up. We can save at least £100 million from this point on.
I would love it if they do that, but they simply won't. You know the one word that never gets mentioned in this inquiry? Sweden. We're constantly told we didn't have the evidence at the time. I've seen social media response to even to what I said on air about this yesterday. About I basically said you don't hate Boris Johnson enough, because it's the self-justification as well. He was weak and hopeless, and he didn't actually he went along. The media were pressuring. Well, what happened was there was propaganda, and it was coming out from China, and there was stuff online of social media pressuring people in the West to do this. There was propaganda for making the public very, very scared. The government joined in, telling us basically we're all going to die, and then we had the media demanding lockdowns and action, and then they basically gave into it. But I still remember that couple of press conferences that were given by Boris Johnson with Patrick Vance and Chris Whitty, where they did the whole explanation of why they weren't closing schools, because it really wouldn't make much of a difference but would do a lot of damage, why there was evidence not to lock down, why they were doing this, why they were doing that, and even explaining when they did announce the first lockdown that it was about, remember, it was flattening the curve, the Mexican hat, wasn't it, the sombrero, and it was just because it's only because we're going to be overwhelmed in this particular period. Now, as it was, that wouldn't have happened. We know from the data the infections were already going down. But even after that, and then they sort of couldn't get out of it because politically they didn't want people to hate them, and a lot of people were enjoying lockdown and kind of enjoying the frisson. And people like me went along with it because I thought, because they'd been honest beforehand and been sensible, that they had new evidence. They didn't have any new evidence. They had Neil Ferguson, who briefly stopped going on his bike to shag his mistress to do a bit more computer modelling that was completely as useless as all other computer modelling he'd done, and apparently we were all going to die. That was a lie. The whole time, Sweden was not locked down. No child under the age of 16 missed a day of school. Their health service wasn't shut down. Their economy wasn't shut down. Their cafes and restaurants stayed open. And that was happening, and people watching it. And we know the results. Sweden had fewer COVID deaths, fewer other deaths Their economy is not trashed. Their children's mental and physical health and education isn't trashed. The evidence is impossible to deny, but most people in government still think they did the right thing.
You forgot to mention Dominic Cummings' trip to Barnard Castle to test his eyesight out.
Don't.
But you're dead right. So the CMO, this is, I find, irrational, said, well, we had to close them because there'd be 1,000 more deaths and infections. Yet Sweden negates all of those arguments because they made the choice to keep preschools open, primary schools and lower secondary schools open. About 1.8 million pupils attended school in person. That's 1/5 of their population. The studies, what did they find? They found out later that they did have the teachers had slightly higher risk of infection in 2020 than the general population, but not higher than healthcare. But importantly, they showed child-to-adult transmission was relatively low and large outbreaks among primary school pupils were rare. Therefore, it negates all of these people who are supposed to be in the advisory positions. Chief medical officer uses his opinion. His opinion said, oh, well, we shouldn't have had a rule of 6. We should have had 3 households. I'm like, why not 4 flats? It's like a game for these people.
And we know a lot of this stuff was just like there was no medical evidence. And that's why different countries had different rules. Was it 2 meters, 6 feet, whatever? It wasn't just they had different ways of measuring it. They literally plucked this stuff from thin air and then went, yeah, we'll just make that the rule.
And that's exactly what they're still doing. And in effect, if you look at it, they're going basically with school closures. We had no plans. We just changed our mind. If you look at Boris Johnson in 2021, he was going, schools are going back. They're open. It's time to get back to school. 48 hours later, they're closed again. So this is the people who flip-flop because basically they have not a clue what they're doing.
But that's why we have
anxious.
That's the whole point of having pre-pandemic planning, which we had. And lots of people say that Sweden was an outlier. Again, lots of people will look at the stats, go, oh, look, Sweden had a whole load of extra COVID deaths in 2020. But, you know, over the period, they had fewer even than their fellow Nordic countries because they kept things open. But also, I mean, they made some of the same mistakes we did about care homes and the like. Yeah. But the crucial thing is, though, when you've got that comparison. But people say, well, Sweden was an outlier. No, Sweden was the only country that followed World Health Organization and all international pre-pandemic planning. They stuck to the plan and it saved lives and it saved the economy. And it also stuck to the basis of making all public policy, which is a cost-benefit analysis. What is the cost of doing this? What is the benefit? And the reality was they knew that the costs were going to be huge of what they did, not just economically, the debt we're in right now, all the financial problems we have right now, COVID. That's what it's down to. The impact on education. We've still got hundreds of thousands of children who don't go to school regularly. We've got 100,000 children with mental health problems, physical health problems. We've got kids arriving at school who, you know, don't even know how to speak properly because, you know, at home. You name it. Our health service is still not back up to speed because they basically shut it down for 6 months. No other country did that. There are so many things that they made decisions about, which they must have known would have happened because a basic cost benefit analysis, and we've always known now since there was no cost benefit analysis, and there should be no policy ever that is so great and impacts our civil liberties, our economy, our health and everything else, where no one has even gone, I wonder what the downsides might be, Carl.
So, look, this last 60 seconds and the point I'm going to make on the back of yours and the cost-benefit analysis, get your people to send this to the inquiry because this is hugely important. We now have the data about you've closed schools and all the catastrophic harms it's caused, not just about educational problems, mental health, all sorts of issues that children are still dealing with today. You can then now do a cost-benefit analysis on what that means, and I can tell you it's never going to meet a threshold that you can close schools ever again. Now, let's put it this way. You don't need to, if you had a pandemic where children were dying, you wouldn't need marketing and a mandate because parents would just say, I'm sorry, I'm not taking them to school until we sort this out. You don't need the government to come in and tell you then because we're good at judging risk. But you're dead right. We didn't have a cost-benefit analysis then. But we definitely can generate one now, and the inquiry can do that and then look at the threshold and say, oh dear. This is hugely costly to children, and they're still paying the price.
Absolutely, and there's no doubt at all as well, even Boris Johnson acknowledged this, effectively, you know, it was children paying a huge price, he said, to protect the rest of society. Any society where you expect children to pay the price to keep 80, with all due respect, I don't mean to be harsh, but 80 and 90-year-olds alive for an extra 2 months, I'm sorry, I think that's obscene, and it's not the way certainly everyone I know of that age thinks it should have happened. Carl Heneghan, you've been a fantastic advocate on this, Professor of Evidence-Based Medicine at the University of Oxford. Thank you, as always. Claire Pissell, I mean, this is the thing, we've got the data, and no one's acknowledging the data.
No, I know, and I think they just want to bury their heads in the sand because they don't want to admit that perhaps they were wrong on
And the
this.
media don't want to admit it because they cheered it all on.
Absolutely.
They were queuing up on my house. Oh, please, Prime Minister, are you going to lock down sooner and longer? Please, Prime Minister.
Yeah,
That's
why
what
haven't you
did.
locked down? Why haven't you got these people? Yeah,
Should be ashamed of themselves.
But they're never
really
going
should.
to be.
The biggest story of your lifetime. You blew it, guys. You blew it.
Yeah.
11